Hello everyone, I'm Emily and I'm a podiatrist by background, working within Solent NHS Trust. Between July and August this year, I was a part of the Versus Arthritis Allied Health Professional Midwifery and Nursing Internship Programme, working with researchers at the University of the West of England and allied health professionals from Royal United Hospitals Bath. This evening, I'll be giving a presentation on the research protocol for the project I'm working on, which is a scoping review looking at access to chronic pain services for adults from minority ethnic groups in the UK. So to give a bit of background, there is broad ethnic diversity across the UK. The percentage of the UK population, which is white British, has decreased when comparing ethnicity data from the 2001 census and 2011 census. The prevalence of chronic pain in the UK population is between 35% and 51.3%, which equates to approximately 28 million adults. The prevalence of chronic pain is similar between different ethnic groups, with data from the Versus Arthritis Chronic Pain Report 2021 suggesting people from black ethnic groups are more likely to have chronic pain than people of other ethnicities. Access to chronic pain services and an emphasis on a multidisciplinary approach are recognised as important aspects of the treatment for those with chronic pain conditions. There are estimated to be one pain treatment facility for every 200,000 to 370,000 people living in the UK. Little is known about the access and use of these services by ethnic minority groups, as pain treatment settings across secondary and tertiary care in the UK and the treatments and services they deliver have been traditionally developed for and evaluated with white English-speaking individuals. So in terms of our aims and objectives, we hope to determine if adults with chronic pain are accessing secondary and tertiary pain services in the UK, and to determine if adults with chronic pain who are accessing these services are representative of minority ethnic groups. We also hope to determine whether the percentage of adults from minority ethnic groups with chronic pain who are accessing pain services in secondary and tertiary care across the UK is consistent with what would be expected given the ethnic breakdown of the UK population and chronic pain incidence within the UK and different ethnic groups. We've had discussions with a leading expert epidemiologist in the field of chronic pain, and through consultation with them, we'll be using ethnicity data from the 2011 UK census, as data from the 2021 UK census is unavailable, and we'll be using data on the incidence of chronic pain in the UK, determined by Pfizer et al.'s 2016 systematic review, as these are the best evidence currently available to get a best estimate for this. In terms of our study design, comprehensive searches of the literature using Embase, Medline and CINAHL bibliographic databases and grey literature for records that address the study aims will be performed. Eligible studies should report on access to chronic pain services in secondary and tertiary care in the UK by the adult population and state the ethnicity of the involved participants within the demographics. There will be no restriction on the type of study, as we'll be exploring qualitative and quantitative methodologies to draw robust and broad conclusions of what the cumulative evidence says on this topic. Publication date will be limited to 2004 to 2021, as demographic data from studies published in this period should represent the UK population recorded in the 2011 UK census. The screening selection process will be conducted by 4 reviewers. Key data from included studies will be extracted by 1 reviewer and a descriptive synthesis of the extracted data performed. Information about the number of adults from minority ethnic groups who are accessing chronic pain services will be gathered and summarised as part of the descriptive synthesis. This information will then be compared against what would be expected given the ethnic breakdown of the UK population and chronic pain incidence in the UK population using ethnicity data from the 2011 UK census and the best available data on the incidence of chronic pain in the UK as discussed earlier. This is a protocol for a scoping review, therefore we report here the results of the search, screening of the records and selection process. The initial database search identified 147 records and 13 additional records were identified for a search of grey literature. After removing duplicates, 124 records were screened against inclusion criteria on the basis of title and abstract. 80 records were removed as they did not fulfil the criteria for inclusion. Full text of the remaining 42 records were obtained for further assessment for eligibility and selection for inclusion. When complete, this review is likely to be the first to explore access to chronic pain services for adults from minority ethnic groups in the UK. We expect the research on this topic to be broad and comprise a mixture of qualitative and quantitative approaches. We anticipate the review will highlight data on the access and use of chronic pain services by minority ethnic groups to help inform service improvement. Thank you for listening and giving me the opportunity of presenting at this conference. I would like to thank my fellow authors for their contributions to the project and Versus Arthritis for funding the project. I am happy to take any questions you have. Thank you.